Chairman, we're ready to begin.
Good morning, everyone. Denisha, if you will do the roll call for the board members, please.
Yes. I'll begin with Norman Boyd,
Here.
Tommy Hopkins,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Kathleen Ruth,
Here.
David Cruz,
Here.
Anthony Williamson. Anthony Williamson. Chairman, that concludes my roll call.
Thank you, Denisha. We have a quorum certainly, and we will call the meeting to order. Dr. Hopkins, have you had a chance to review the minutes? And if so, would you make a motion to approve?
Yeah, the minutes were sent previously for your review, and if there are no additions or corrections to the minute, I'd like to have a motion that I'll make the motion we approve those minutes.
Do we hear a second?
Dr. Cole, second.
Okay, we have a motion and a second. Any additions or corrections? Hearing none, all those in favor of the motion by aye.
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 Opposed, no. Motion carries. The minutes are approved. Well, opening comments, I feel compelled this morning to certainly pay tribute to Norm again. Norm, I sort of feel like that 16-year-old boy that's been given the keys to the car for the first time. And we want to pay tribute to you for your long tenure as chairman of this board. I am honored to serve as chairman, as I know Dr. Rucker and Dr. Hopkins are as well as officers of this board. And we will do our very best to conduct the business of this board in an orderly fashion.
Thank you, Roger.
We have 3 items to consider for final adoption today, and we have 3 items for initial adoption. So we have some work to do today. And with that, I want to thank Denisha and Commissioner Carlson for prepping me as the incoming chair. You are certainly right, Norm. Denisha keeps the trains running on time, and we're very appreciative for that. With that, we'll get to work. Commissioner's report, Commissioner Carlson.
Thank you, Mr. Chairman. Appreciate all you do, and I echo your sentiments for Mr. Boyd. Mr. Boyd, this is the first time Denisha and I have sat next to each other, so we miss having you here. I'm now within a striking distance, so the kick to the shin, you're not here to buffer me anymore, so I'll try to stay on message. But good morning, Mr. Chairman, members of the board, and those of you watching virtually. It's a rainy day here at Sloppy Floyd in downtown Atlanta, but thank you all for participating. The DCH team has been working hard over the past few weeks, as represented here on the full agenda that Chairman Folsom referenced. In addition to the hard work you'll hear about today, the department has been speaking with stakeholders on a range of issues at their various conferences and gatherings, as well as a large contingency of DCH leadership attending the annual NAMD, National Association of Medicaid Directors, conference in our nation's capital just earlier this week. As you can imagine, Washington was an interesting place to be on the weekend and week following an election. Thanks to Stuart Portman, our MAP director, and Lynette Rhodes, our chief health policy officer and longtime NAMD leader, for leading our delegations and representing us well as always. I also want to thank our SHBP team for covering the large state multiple times over during this year's open enrollment period. This year was especially active given some of the changes specifically in our Medicare Advantage plan, which required its own additional separate education series on top of open enrollment activities that were geared towards our retiree members and their families. Thank you for being on the road. I think we compiled, from what I gather, over 100,000 calls into our customer service center. 225,000 SHBP members chose to make some sort of new or different election. So people were taking an active role in their coverage. And over 10,000 SHBP members attended one of our town halls throughout these couple of weeks, 6 weeks or so, including a couple of webinars. So if you really think about 10,000 people attended our event. So thank you to the entire team for the curriculum and getting out on the road away from your homes, not to mention keeping up with your day-to-day activities that were still piling up. But back to our agenda, as always, today's items largely reflect the department's efforts in collaboration with other agencies and impacted stakeholders to implement the priorities passed by the legislature earlier this year. Namely, today you'll see the certificate of need items. Director Lang will be speaking to those shortly. As you recall, HB 1339, which was actually sponsored by the Rules Chairman Butch Parrish and co-sponsored by Speaker Burns himself, was signed into law by Governor Kemp just this past April, after months of thorough debate both at the legislature and study committees prior to the session. CON, as we all know, is complex and sensitive and it's largely statutory in nature. Therefore, our health planning and legal teams have spent countless hours not only researching and drafting themselves, but engaging outside parties and legislators to present something we feel accurately represents the legislative intent behind all the policies that were advanced in HB 1339. Should today's items receive final adoption, there is an additional step that everyone should be made aware of. It should also be noted that the same legislation requires us to pass along those additional items that may warrant further discussion or definition. We pass these items off to the Office of Legislative Counsel, Ms. Howerton and their team, and these items can be considered for the 2025 session. It will then be the prerogative of the General Assembly to act or not on those matters or any other that they deem a priority as it pertains to certificate of need. So to Cretia and her talented team, stay tuned. We may be right back at this in the months ahead. But as always, your team is up to that and does so with such professionalism, and we're very grateful for it. In addition to CON, the items presented by Melanie Simon and Brian Dowd also represent legislation signed into law by Governor Kemp this past year. And a big thanks to your teams as well for the work that has gone into that with internal and external stakeholders alike. And lastly, speaking of teams, I'll quickly pivot to our custom of presenting some well-deserved employee milestones here at the department, and then we'll move back to the agenda. So we have a big one to kick off with from MAP, Deborah Underwood, 25 years. Thank you, Deborah, for your service. 15 years, Adrian Copeland at HFRD, 15 years. Rabina Sharif, Katie Beckett, 10 years. Other 10 years, Xavier Davis, IT. Kaylee Laveau, HFRD. Teresa Fuqua, MAP. And Michael Reeves in Procurement, Financial Management Division, all 10 years. For 5 years, we have Tanisha Bivens in the IG's office. Hallie Mentor at HFRD. Katrina, 5 years. Lynette, she's so well experienced. I would have thought she'd been here longer as hard as she works. Olivia Gunn, thank you, Livy, in Communications, 1 year. Destiny Calhoun, MAP, 1 year. David Jones, IT, 1 year. Rhonda Lynn Traylor, HFRD, 1 year. Alexis Smith, SHBP, 1 year. And Courtney Watkins, SHBP, for 1 year. So thank you to all of the team members, both those tenured at 25 years and those have just come on board and celebrating 1 year. We value all your contributions and your willingness, as we say around here, to jump in the deep end with us here at DCH. So with that, Mr. Chairman, that concludes my remarks for now, and I'll defer to you for the remainder of the agenda. Thank you.
Thank you, Commissioner. Any questions or comments for Commissioner Carlson? We certainly echo our appreciation to all those employees you recognize, Commissioner.
Yes.
We'll move into the agenda now. First item is rules and regulations for health planning administration. So Carisha Lang, our Executive Director for Office of Health Planning, if you'll present this to us, Carisha.
Good morning, Chairman Folsom, Commissioner Carlson, and members of the board. The Department's Office of Health Planning requests final adoption of the proposed amendment for rules and regulations for Health Planning Administration Rule 111-2-1. The proposed rule changes reflect amendments to the State Health Planning and Development Act, OCGA 31-6-1 et sec, as a result of the passage of House Bill 1339 during the 2024 legislative session. The proposed changes make updates to the health planning regulations so as to provide for review and update of the state health plan every 5 years to ensure the plan meets the evolving needs of the state. Additional revisions are proposed to correct grammar. I would like to note that the state health plan, as referenced here, is a compilation of the various need methodologies, standards, and rationale used to evaluate projects involving facility types and services that require a certificate of need. An opportunity for public comment was held on October 8th, 2024 at 11 a.m. via Zoom. Written comments were due on before October 11th, 2024. No oral comments were received. No substantive written comments were received. The department requests approval for final adoption. I'm happy to address any questions about the changes.
Any questions or comments from the board members? Hearing none, is there a motion for approval?
Motion for approval, Cynthia Rucker.
Dr. Rucker has made a motion for approval. Is there a second?
Seconded, Kathleen Ruth.
And Dr. Ruth has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Carisha, you may proceed on to the next item, which is rules and regulations for health planning certificate of need.
Thank you, Chairman. For the next agenda item, the Department's Office of Health Planning also requests final adoption for the proposed amendment for rules and regulations for health planning certificate of need, Rule 111-2-2. The proposed rule changes reflect amendments to the State Health Planning and Development Act, OCGA Sections 31-6-1 et sec, as a result of the passage of House Bill 1339 during the 2024 legislative session. The proposed changes make updates to the health planning regulations so as to provide provisions relating to certificate of need requirements, to revise definitions relative to health planning and development, to eliminate capital expenditure thresholds in certain circumstances, to revise provisions relating to acceptance and review of applications, to provide a timeframe for opposing an application, to revise provisions relating to appeals, to revise and provide for additional exemptions from certificate of need requirements, and to increase fines for reporting deficiencies. Additional revisions were proposed to correct grammar, provide clarity, and modernize the rules. An opportunity for public comment was held on October 8th, 2024 at 1 p.m. via Zoom. Written comments were due on or before October 11th, 2024. No oral comments were received. Written comments were received from the following: Carrie F. Conley, General Counsel with Georgia Hospital Association, and Monty Veazey, President CEO of Georgia Alliance of Community Hospitals. The following summary of comments were received. GHA expressed its general support for the proposed rule amendments and recommended additional revisions to clarify certain exemptions, review timelines, and definitions. GACH also expressed its general support for the department's efforts to implement the proposed rules and requested further clarification on CON review and application timelines, definitions, and the applicability of the rules for specific health services. The department thanks GHA and GACH for their written comments and general support. The department will move forward with an amendment in the near future to provide additional clarification to address the comments provided. We look forward to our continued partnership with GHA and GACH as part of that effort. The department requests approval for final adoption. I'm happy to answer any questions concerning the proposed changes.
Are there any questions from board members? Comments?
Ms. Hopkins, when will we address those comments from GHA? Which board meeting will that be, or will it?
I'm sorry, I didn't hear the question.
When will we address the comments from GHA and GACH? The next board meeting or after the legislative session?
So, Dr. Hobbs, this is Russell Carlson. As far as the comments, the suggested changes that are found in your packet were not necessarily adopted in these implemented into these rules as far as some of the red line documents that you see in your packet. But they did submit them, and while we're not considering them now, we probably will hand over some items for further discussion to the Legislative Council, which will in and of itself be a public document. It will be a formal report for all to see. My not suggestion, but my feeling is that we will probably take some input from the legislature to understand what they will be pursuing and then guide our actions accordingly. In other words, given, like we've always said, how statutory in nature this is, I do feel like alignment with the legislature is important. And if these are things that they might consider contemplating in the session, well, we could probably benefit from watching those discussions take place before we take action.
Thank you for the clarification, Russell.
Yes, sir.
Are there any other questions or comments? Hearing none, is there a motion for final adoption?
So moved, Hopkins.
Is there a second?
Second, David Cruz.
Dr. Hopkins has made a motion for final adoption. David Cruz has seconded that motion. Is there any further discussion? Hearing none, all those in favor of the motion by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Thank you, Carisha.
Thank you. If I may, before I yield to the next presenter, I just wanted to thank Commissioner Carlson, the executive leadership team, certainly the Office of Health Planning, and everyone that worked on getting these rules finalized. Thank you.
Very appropriate. Thank you. Next item on the agenda, also to be considered for final adoption, is rules and regulations for healthcare facility regulation, adult residential mental health programs. And Melanie Simon, our general counsel, will present to us regarding this. Melanie?
Good morning, Chairman Folsom, Commissioner Carlson, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption. These rules are found in Chapter 111.8.2 of the Department's Rules and Regulations, and they establish a new facility type known as Adult Residential Mental Health Programs. The rules provide minimum standards for this new facility type. A public comment hearing was held on October 15th, and written comments were due on or before October 18th. We received 2 oral comments and 1 written comment. Mr. Stan Jones, an attorney with the law firm of Nelson Mullins, expressed a concern that the language would require all members of the facility's board of directors, including volunteer members, to obtain a fingerprint criminal background check, even if the board member does not have contact with patients at the facility. Our response is that there are separate rules for criminal background checks, and pursuant to those rules, board members who have no ownership interest in the facility and who are not exercising control over the facility or demonstrating involvement in facility operations or patient care would not require a fingerprint background check. We appreciate the comment provided by Mr. Jones. As the Healthcare Facility Regulation Division develops application materials for this new facility type, we will ensure that this issue is addressed in those materials with additional clarity. The second comment was from Dr. Bola Sagade. Dr. Sagade is an OBGYN who works at the OBGYN Birth Center for Natural Deliveries. She commented that these rules do not require that the medical director of the adult residential mental health program have admitting privileges at a local hospital in the event of an acute emergency, whereas physicians practicing in a freestanding birth center are required to have admitting privileges. Our response is that the state law upon which these rules are based, which is known as the Adult Residential Mental Health Services Licensing Act, does not contain any requirement for the medical director at the adult residential mental health program to have admitting privileges at a local hospital. In contrast, state law does require that birth centers provide either a hospital affiliation agreement, evidence of admitting privileges, or other acceptable documented arrangements with an acute care hospital in order to satisfy the health planning requirements, which are a prerequisite to obtaining a licensure permit. While the department does consider parity concerns between different facility types as a relevant factor in development of rules, we give great deference to the minimum requirements outlined in the statute. These were the only comments received. As such, we are requesting consideration for final adoption of these rules today, and I'm happy to answer any questions.
Are there questions or comments for Melanie, from any of the board members? Hearing none, is there a motion for final adoption?
Motion for adoption, David Cruz.
David Cruz has made a motion for final adoption. Do I hear a second?
Hopkins, second.
And Dr. Hopkins has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion by aye.
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 Opposed, no. Anyone abstaining? Motion carries. Thank you, Melanie. You may move on to the next item for initial adoption.
Thank you. These rules are the general licensing and enforcement requirements, and they are also being presented today on behalf of the Healthcare Facility Regulation Division. They are found in Chapter 111-825 of the Department's Rules and Regulations. The purpose of this amendment is to establish an annual license fee for this new facility type, adult residential mental health programs. And you will see in the rules that we have established an annual fee of $800 to obtain a permit for those new facility types. An opportunity for public comment will be held on December 17th, 2024 at 11 a.m. via Zoom. And we will accept written comments on or before December 20th. I am requesting consideration for initial adoption today of these updates to the general licensing and enforcement rules, and I will pause for any questions.
Are there questions or comments for Melanie? Hearing none, is there a motion for initial adoption?
Cynthia Rucker. Motion for adoption.
Dr.
Initial
Rucker,
adoption.
Dr. Rucker has made a motion for initial adoption. Is there a second?
Dr. Cole, second.
Dr. Coles has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion by aye.
Aye.
All opposed, no. Anyone abstaining? Motion carries. Thank you for that, Melody. We'll move on to rules and regulations for hospitals for initial adoption also.
Thank you. These rules are also presented on behalf of the Healthcare Facility Regulation Division. The hospital rules are located in Chapter 111-840 of the Department's Rules and Regulations. The amendment presented before you today removes the requirement for an order or referral for screening mammograms. This change is not necessitated by any change in Georgia law, but is done in order to align the department with Medicare policy as well as policy of most major insurance carriers, if not all. We will hold an opportunity for public comment, a Zoom call on December 17th at 1 p.m., and written comments will be accepted on or before December 20th, 24. And I will certainly be happy to answer any of your questions. Our request is consideration for initial adoption. Thank you.
Are there any questions or comments for Melanie? If not, is there a motion for initial adoption?
Hopkins, so moved.
Dr. Hopkins has made a motion for initial adoption. Is there a second?
Seconded, Kathleen Ruth.
Dr. Ruth has seconded the motion. Any further discussion? Hearing none, all those in favor signify by aye.
Aye.
All opposed, no. Anyone abstaining? Motion carries. Thank you.
Thank you.
Next item on the, thank you, Melanie. The next item on the agenda is the Medical Assistance Plan, State Plan Amendment Program of All-Inclusive Care for the Elderly. By Brian Dowd, our Deputy Executive Director for Policy Compliance and Operations, will present. Brian?
Thank you, Mr. Chairman, Commissioner, and members of the board. Today, I am presenting for initial adoption an amendment to the Medicaid State Plan to include the Program for All-Inclusive Care for the Elderly, or PACE, effective January 1st, 2025. PACE is a Medicaid service delivery model. It provides comprehensive medical and social services to individuals 55 or older who meet a nursing facility level of care and are living in the community. PACE is a program that is dually funded under Medicare and Medicaid. PACE is an optional Medicaid benefit that members choose to elect. Once the member elects PACE, the PACE program becomes the sole source of Medicaid and Medicare services for the PACE participants. This would include all medical services like doctor's visits, labs, prescriptions, hospitalizations, durable medical equipment, and those things you typically think of under a home and community-based service arrangement like personal support services or home delivered meals. PACE services surround a center where participants can choose to visit, like an adult day health center. An interdisciplinary team of health professionals provide PACE participants with coordinated care. The centers have an adult day health center, clinic, and other on-site services such as meals and activities. Financing and therapy, most of them have a therapy center as well. Financing for the program is capped and paid on a monthly per diem arrangement, similar to how we pay our care management organizations. This allows PACE providers to deliver all services the participant needs. This includes services that are not typically reimbursable under Medicare and Medicaid fee-for-service plans. To give you an example, Joe Hood and I were able to recently visit some PACE centers as part of a national association meeting we attended. One PACE center had a hair salon that was located in it. Another center had an adjoining chapel that the members could visit. PACE organizations can be nonprofit, private, or public entities primarily engaged in providing PACE healthcare services. PACE organizations are chosen via a competitive request for proposal by proposed service area. PACE organizations must have a governing board that includes community representation, a physical site that is 10,000 square feet or larger to provide these services, a defined service area, the ability to provide the complete service package regardless of frequency or duration of services, safeguards against conflict of interest, and demonstrated fiscal soundness. PACE is expected to provide an overall cost savings to DCH. the monthly per member per month charge per actuarial analysis is less than what it would cost the department to serve the members otherwise. It's actually what we call the AWOP in the payment, which is the amount that would otherwise been paid. And that's what, we didn't make that up. That's what PACE calls it everywhere. An opportunity for public comment on the proposed change will be held on November 18th, 2024 at 11 a.m. via Zoom. Written comments are due on or before November 25th, 2024. If there are any questions, I'll be happy to answer them at this time and will respectfully request initial adoption of the Medicaid State Plan Amendment to include PACE.
Any questions or comments for Brian?
Just one question, Mr. Chairman. If I may, it's David Cruz. Has the department been able to gauge potential interest in this service?
Yeah, that's a great question, and we have. So we've done, for about a year now, I'm looking at Joe to nod at me. About a year now, we've done a lot of outreach to the community, whether it be at gossip meeting, leading age, healthcare association meetings. We've also been involved last year's legislative session. There was some funding that was set aside for nonprofits that was run by our Office of Rural Health, the awards for those nonprofits for capacity building. So I was able to be on the RFP committee for that, for those grants, and we gave out 3 grants for capacity building. And we've had multiple conversations with other providers, both within the state and national providers, about bringing PACE online. And also, we will have a town hall meeting tomorrow afternoon that's open to the public, and it's on our website that informs folks about PACE as well.
Any additional questions for Brian from any board members?
I do. What does the cost savings look like? I know you mentioned the AWOP, but what does that look like?
So the way that all states really typically, and this is kind of like a federal thing that they look at what the cost savings is they calculate what it would serve the individual to otherwise be served in an institutional setting. And then we actually pay less than what that cost would be. So we pay slightly less or right at it so that we ensure that we're not paying out more money. It is important to note that in all the research with PACE, individuals who participate in PACE, the length of time that they are able to stay in their own homes and in the community is greatly expanded to the point where some people never go into a nursing facility, hospital, or inpatient hospice. It's overall for states and areas that have adopted it, there is a very strong history of cost savings for that reason.
Any additional
you.
questions? Hearing none, would there be a motion to approve for initial adoption?
Hopkins, so moved.
Dr. Hopkins has made a motion for initial adoption. Is there a motion for a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor signify by aye.
Aye.
All opposed, no. Anyone abstaining? Motion carries. Thank you so much, Brian, for your presentation.
Thank you, sir.
Next on the agenda, Lynette Rhodes, our Chief Health Policy Officer, will be giving us some information on revised CMS long stay quality measures. Lynette?
Hi, good morning. Good morning, Chairman Folsom, Commissioner, and members of the board. As always, thank you for the opportunity to present. In September of this year, DCH announced its intent to revise the methodology for distribution of the supplemental quality incentive payments to eligible skilled nursing facilities and our intent to revise the long-stay quality measures to be utilized. We informed the board and the public during the September board meeting that we would provide formal notice of the revised quality measures to be utilized during calendar year 2025 during today's board meeting. The board granted approval to move forward in this direction. Thus, I am here today to announce the new quality measures that will be utilized during calendar year 2025. Eligible skilled nursing facilities must demonstrate improvement in at least one or more of the following categories as compared to calendar year 2024 in order to be able to receive a supplemental quality payment during state fiscal year 2026. The four categories are as follows. The first is the percentage of long-stay residents who lose too much weight. The second is the percent of long-stay residents with a urinary tract infection. The third is the percentage of long-stay residents who received antipsychotic medication. And the fourth is the percentage of long-stay residents experiencing one or more falls with major injury. These will be the four long-stay quality measures that will be applicable during calendar year 2025. As announced during the September board meeting, the supplemental payment will be based on each nursing facility's overall ranking in each of the measures, resulting in the nursing facility receiving a payment proportional to their level of improvement. Additionally, during calendar year 2024, we have had one change that I would like to address as well. In October of 2023, CMS, that's the Centers for Medicare and Medicaid Services, discontinued use of one of their quality measures. That quality measure was the percentage of high-risk long-stay residents with pressure ulcers. Consequently, DCH will discontinue its validation of this measure for calendar year 2024. Accordingly, the supplemental payment that will be issued during state fiscal year 2025 will be based on the percentage of improvement in 3 quality measures only. Previously, there were 4, but again, CMS discontinued use of one of those measures. Thus, we will no longer be able to validate that one measure. So now the payment will be based upon improvement of 3 measures. Those 3 measures are as follows. The first is the percentage of long-stay residents who received anti-anxiety or hypnotic medication. The second is the percentage of long-stay residents who received antipsychotic medication. And the third is the percent of long-stay residents with a urinary tract infection. Just as a reminder again to the board, this is for informational purposes only. We do not require a vote from the board, and there will not be a subsequent public hearing. I will pause now for any questions or comments from the board.
Are there any questions for Lynette from board members? Lynette, thank you very much for that presentation.
Thank you. Have a wonderful day.
Is there any new business that anyone's aware of that should come before the board? With closing comments, I would like to say that I am deeply saddened we had to delay the meeting in Dublin in December. We still have numerous blue tarps and massive trees down, and as of this week, we have the U.S. Army Corps of Engineers here assisting the county and the city in storm debris removal. And we unfortunately actually have some homes that still there are large trees on. And it will be probably 60 days at least before the town is back to anywhere near normal. But we look forward in the spring of entertaining the board here and having some fun and getting to know each other face to face. And we look forward to that then. I want to thank each of you for your participation today and to wish each of you a happy Thanksgiving. Regardless of our situations, we all have much to be thankful for, and we'd ask that you reflect upon that during this season. If there's no other business to come before the board, we stand adjourned. Thank you.
Thank you, Chairman.
Thank you.
Y'all have a good Thanksgiving.